parents ask, what about my child having bleeding gum? Doesn't everybody? I had 6 of them, and they all had bleeding gums. And I remember I was having bleeding gums. That's what, parents kind of, and most people out there say. So, is a little bit of bleeding a problem or not really?
Bleeding gums is a sign of what we call gingivitis. It is not a good thing. So what we want to do is, if you have bleeding gums, what you want to do is get the gums healthy. Usually people that have bleeding gums, it's because they're brushing their teeth either up and down or side to side, or they're not brushing enough. So what is needed is to brush the gums in circles. And each area, you go every 2 to 3 teeth, you brush in circles on the gums and the teeth, instead of just concentrating on the teeth. For children that are younger than, say, 18 years of age, 16 years of age, cavities are the most important thing. As they get 16, 18 years of age, they have more adult problems with their mouth, which is gum disease. So teeth that are lost earlier than teenage years are usually lost due to cavities. But teeth that are lost after the teenage years and during teenage years can be due to gum disease. Okay? And the gum disease starts in your teenage years with the bleeding gums. And then as we progress as older, it becomes what they call periodontal problems. What the old term a long time ago was pyorrhea, periodontal problems, where you have bone problems. Okay, so not just gum, but then it becomes more invasive and becomes a bony problem. So bleeding gums is the first sign. When I have a child come in the office, they don't have any cavities, they're like 3 years of age, maybe they have 1 cavity, and the parent says, well, I'm not brushing much, but, all I see are these little bleeding gums. I said, well, if you continue not to brush the gums in the circles, or if you do not brush the teeth and gums enough, 2-3 times a day, you're going to find that when the child turns 4 to 5 years of age, they're going to start having a lot of cavities, because the teeth are going to start being less resistive to the food, less resistive to the bacteria, and they'll get cavities in between the teeth or along the gum lines. So the very first sign that we've got problems is bleeding gums.
I see. Well, obviously with adults, I'm going to ask you this question in a different in a different video. Gum disease is not only about losing teeth. Gum disease, while one loses the teeth, which may take a half a decade or whatever it might take, the body gets poisoned on a minute-by-minute basis, because that infection, that yellow, ugly pus in the mouth, travels to the blood, goes to the kidney, lowers the immune system. So it makes sense to me that if a child has bleeding gum, no matter what, that means he or she has an infection, period, because the gums wouldn't bleed otherwise, except getting punched by the school bully. That's a different story. But
yeah, we're not going to talk about that.
No. But rather than that, the gum has a disease. The immune system gets lower, and for a child, that may be contributing in this case to get the flu easier, and all those tiny little things, those sniffles and that stuff, because the immune system is down, simply because all the health soldiers, as I call them, have to go and try to fix that gum disease, but can't fix it. They're just there. A little bit like with some ongoing wars, which we might have known about in the United States, and there they are, and they're just sucking it in and sucking it in. And if there's then a real threat coming, such as another war or something, where are we going to get the soldier from? Because they're all in one area, and they all tried the place out. And children are more susceptible to flus and stuff than a strong 20, 30, 40-year-old adult, I guess. I don't know.
Well, that's when it begins. And what you're talking about there, the long-term effects, periodontal effects that affect our heart, like you said, the total immune system, that comes as an adult. I don't see it as much in pediatrics, but it is a beginning. And so why Why not prevent something or get it when it's just minor? Like I said, with even cavities, get these things when they're minor and very small. So that's best time. Children are resilient. You brush the gums on a child and they're bleeding, within a few days, they're going to be healthy and look good. An adult that had that problem for a while, it's going to take weeks, months, maybe longer, but the situation with a child, that can be all rectified very quickly, and you're teaching them great habits. So, yeah, bleeding gums is a first sign, the first tip off there's a problem. And so we need to get after that, and then you'll have less cavities, less health problems, just as you mentioned, and in the long term, you're going to be a helpful, happy life.
Right. And because, as you said, so the bleeding gum is coming almost all the time simply because of a not correct brushing, flossing, and not correctly and often enough going to the dentist and getting the plaque removed. So if that starts as a younger person, even though it might not so heavy affect you, you're setting the stage for growing it when you get older. So if you can contain it, if you have it as a young, it's just going to be compounding, and you have it more as an old person, and at that point it almost kind of literally can and will kill you, or at least definitely harm you. All right. Well, yes, you're coming up with very interesting things here, very informational and very valuable things and stuff. Thank you very much.